maybe I'm different and I have to hide behind my mask to appear same so that I'm accepted, because that's what we want in society. And I just gave them the permission to say, you can be different. And I said, I'm home. I'm going to cry, right? These are my people. They get it and they understand it.
Welcome to Vet Life Reimagined. Little different episode today as we have a returning guest, Dr. Laurie McCauley, who previously shared her fascinating journey of pioneering pet rehab medicine. At the end of that episode, she started to mention her experience discovering that she had autism, but since she didn't realize it until her 50s, it was later in her career and therefore her story. Laurie has studied this topic extensively. She's even creating a special free course for NomV, Not One More Vet. So now she's back to share what neurodiversity is, the belief that this is much more prevalent in animal-focused careers than previously understood, and how learning more about neurodiversity can help us make this profession a better place to be. So if you haven't listened to Laurie's previous episode back on November 18th, I'll link it in the description with other resources. Please listen either before or after this one. This is a very touching conversation that I really appreciate. I hope you do too. So let's get to the conversation with Dr. Laurie McCauley.
So neurodivergent is anything that's not neurotypical, right? That's a definition, right? But it encompasses a whole bunch. So people are used to thinking about like people on the spectrum with autism, I won't say with, who are autistic, right? Because it's not with, it's not a disease, ADHD, but there's also dyslexia, dyspraxia, alexithymia, dyscalculia, a whole bunch of things. Let's see, dysgraphia, bipolar, OCD, all of those things go into that neurodiversity.
So it sounds like they're even expanding it farther than back when we were talking about this just a couple of years ago. And just to also bring it back down to our audience that we're speaking to today around the veterinary industry, do we have an estimation or an idea of how prevalent neurodiversity is among the animal health profession or the veterinary industry?
So there's no study specifically on that. We do know that 20% of the American population has been diagnosed with some kind of neurodiversity. In my experience, and one of the reasons I want to talk about this is because I believe it's much higher. One of the things that neurodivergent people tend to do is gravitate toward animals. So if you talk to somebody and they're like, oh yeah, I would rather be in a room with 20 barking dogs than 20 screaming kids, right? That means they gravitate toward animals. And that might be one of many little signs that can put them into a class where they could be tested and see if they have a diagnosis.
Yeah, I think that's very important to call out. I think it's probably under-recognized, not just in the veterinary industry, but across the board. I
Yes.
think we're getting more and more aware of it. I especially hear this for women
Mhm.
because a lot of these traits manifest in a more socially acceptable way for women and girls than they do in boys. That stereotypical rowdy little boy in the classroom versus maybe how it kind of comes across for girls. And so that's just something I've heard, which I will be very careful of. These, I have tried to listen and learn a lot, but this is why I want you on, so you can share a little bit more about your personal experience and what you've researched on a much deeper level. So on that note, I would like to go back to your story. We shared a little bit of it in the previous episode, but I think it's really important here because speaking of, trying to have more awareness of this existing, is that you did not become aware that you were neurodivergent until your 50s. And so do you mind sharing how you came across this and became diagnosed?
Yeah, I would be happy to. I was listening to a comedian, Hannah Gatsby, and she was talking about being neurodiverse and being autistic. And she was saying, oh, and I did this, and I did this, and I thought that. And everything she said, I went, that's how my brain works. Wow, that's how my brain works. Simple things like, small talk is work. right? It's not just easy. Her comment is, you guys talk over there. I'm going to go rearrange the furniture. Let me do something, achieve something, get something while you guys just talk about the little stuff. Things like having time blindness, right? I always say I have a unique relationship with time. I have no concept of it. When I'm somewhere, I am totally focused on what I'm doing and have a hard time maintaining timeliness unless I set my watch or my phone to have, alarm go off to tell me that I have to be somewhere or do something. Other things, face and name blindness. There's times where I will have had many conversations with somebody, and then like 2 years later, I see them and I have no clue who they are. And, I always laugh when I gave the HVMA keynote address. I said, if you see me looking at your chest, I promise I'm not looking at your chest. I'm trying to see your name, even if I know you for years, because my brain doesn't work that way. Things like camouflaging and masking and mirroring, right? Camouflaging and masking are, you're with a group of people and without even thinking about it, you behave like those people to be accepted by those people. And that's a subconscious thing. And then when you get done, you're exhausted. You have no idea why you're exhausted. And I think a lot of us in the veterinary profession come home from work and we've been with our colleagues and our clients, and we've put on this show without even knowing we were doing it, and then don't understand why we get home and there's nothing left. Or things like mirroring. I didn't know I was doing this until I learned about the technique. So, like, for instance, you just nodded, so I would nod, right? And you smile, so I would smile. Then your dimples come out, so you smile bigger. And you follow what the other person is doing, and literally that person's brain. So I used to do it unintentionally until I figured out what it was. But your brain likes me more because I'm doing what you did. And if you feel like you're connected with me, right? And that's another thing that you do, and then you're exhausted. But there's all kinds of things. I am not ADHD, but my partner is, and hard time starting a project, hard time once you're into it, finishing it, right? You get almost to the end and then you don't do it. And it's not a procrastination, it's the way the brain is wired, not finishing sentences. One of the things I've learned from the research is people with ADHD, their brain is literally goes much faster than the neurotypical person's brain. And when they're talking to another ADHD person, they cannot finish their sentences and know where they're at in the conversation, which makes it harder when they're talking to a neurotypical person because I'm like, finish the sentence. And then when you're ADHD and autistic, it's really hard because it's like, can we go back 3 topics ago so I figure out where what's going on is coming from, because I don't understand it. So yeah, the brain just works differently. You have different struggles and different strengths, but you still have really good strengths.
Yeah. I want to come back to some of those terms because camouflaging was a new term for me when I was listening to some podcasts around neurodiversity for this. But for you personally, as you were listening to her describe how
Yeah.
her mind works, which I want to call out because I've had someone else on the podcast that was describing her ADHD mind,
Mm-hmm.
and she did it really well. And so I think that's really helpful when you're able to kind of somehow describe this because it helps you figure out, oh, that sounds familiar. And then you were able to follow that up and try to figure out, okay, is this the case? So I think that's kind of what happened. So once you were identifying with some of these things that you were hearing her talk about, what did you do next?
I talked to my therapist who said, Laurie, I never picked that up. And I'd been working with her for years. And I said, well, here's some of the things. And like one of them was like, I got invited to go to the White House to work on Laura Bush's dogs. And they were going to, one of my clients was friends with her. And she's like, we'll fly you in our personal plane. You're going to go work on the dogs. And I'm like, okay, well, I can do it in about 3 weeks because I'm really booked until then. Right. Also, I had worked on Michael Jordan's dog, but they were bringing the dog in and they're like, yeah, we want you to make house calls. And I'm like, I don't have time for that. I can send somebody else or refer you. But to me, the clients and patients in front of me were people I really care about. So they were more important than someone, even if they have a big title or an important job. That doesn't mean anything to me. When she heard that, she's like, let's get you tested. And then it's a long process to get tested. And I was very blessed because I'm like an hour outside of Asheville, and the person in Asheville that does a true diagnosis is a person who covers all of North Carolina and most of Tennessee. So it was nice and close, but it was like an hour-long conversation. He had a conversation with my therapist, my partner. It was a 4-hour test, another hour-long conversation, a final diagnosis, and then another hour-long conversation to discuss the results.
I'll be honest, I kind of appreciate how in depth they're going
Yeah.
though, because
Oh, yeah.
I hate the idea that some little standardized test or something
Mhm.
is what the only thing that people use to determine something like this. It's important to understand, this, and you definitely, especially when people start putting labels on things, I appreciate that in-depthness of the
Yeah.
assessment, because I have heard some people in psychology mention that there's some flaws in some of the testing for this. So to me, that sounds like they're kind of covering quite a few bases.
Yeah. And honestly, to me, sounds crazy. One of the best things that came out of it is I'm really hard on myself, right? Which kind of goes with it. But I found out I was in the 98th percentile of intelligence for women my age. And that helped me tremendously because my parents, now they're both gone. But if they were here, I would without a doubt have my dad, I could hear my dad say, "Oh, you're retarded." Because in his generation, that's what it was associated with, which crushed me. And having that little bit of, no, I'm intelligent. It's okay. I'm good. I'm good. And talking to my therapist a lot helped me tremendously understand that my brain works differently. But if I was neurotypical, I wouldn't have been the person who designed the first underwater treadmill and started canine rehabilitation and did all of these things. It is truly a gift, and maybe the label can be associated with a curse, but once you understand it and you accept yourself for what you are, it's a great thing.
Well, and I think labels are a society thing, right? The more that we understand something and we communicate about it, then that label changes.
Yeah.
Labels are not, stuck. That's something that we can change with better understanding. So being able to better understand yourself, I
Mhm.
think it is a great place to start. But again, making this a bigger conversation, the psychology community better understanding how all of this works, and so that we can make sure that we are supporting
Mhm.
individuals. And yeah, to me, when you start talking about this, you're starting to see these as strengths. And
Mhm.
this is something I think I mentioned to you, and you seem shocked too, so it made me feel a little bit better, that episode I had mentioned on the person describing her ADHD
Mhm.
and neurodiversity. I think in the title of my YouTube video, I I used the word superpower,
Mhm.
and I had someone kind of upset by that I had referred to it as a superpower or finding your strength. And so I'm open to feedback. I did change the title. I'm pretty sure I did, because I don't want to offend anyone. Again, I'm trying to learn and highlight different opportunities for individuals in our profession, because I think this is a great place for all types of people who want to be here. Can you help me better understand how you see that?
One of the things I taught my kids, one of my kids is diabetic and has some other health issues. And, when you're 7 and you get told, you're different and you have to have a pump and all of this stuff, it's hard. And he's brilliant. This kid is brilliant. So one of the things we came up with, and we remind ourselves, is that for every great strength, you have a great weakness. And for every great weakness, you have a great strength. And it's better to be strong and weak than middle of the road, at least in my head, right? So rather than just trying to be the norm, find your strengths and excel at them. Find your weaknesses and work with them so you can bring them up. but then be happy with what you have because it's all you got. So you might as be happy with it and do the best you can with it.
Excellent. So when you were discovering this, putting words behind it, did you talk about it with your children and your family? And how did that impact you as you were starting to talk more about it?
So at first it was scary. And then I had to come to terms with it. Like I said, I had a good friend who is a psychological nurse who taught psychology, and she helped me. She's the one who's like, Laurie, it's your gift, right? And I have to throw in there Michael Phelps, Walt Disney, Einstein, Jim Carrey, right? There's some amazing people who are neurodiverse, right? They have great strengths. They help me, Lenora, um, Mo, my therapist, helped me get it myself. And then I slowly let people, friends know. Some of them were like, yeah, we knew that. Surprised it took you this long. Most of them wanted to know more about it. With my kids, I'm like, okay, there's these tests. I want you to align. I want you to take these tests. And it turns out they haven't been officially diagnosed, but through the tests, one of them's ADHD and one of them's autistic. And the other thing to realize, like, at least with ADHD, is you may have a child that you're like, oh my God, they're hyperactive. They're really smart, but they can't sit still. If there's a child who's diagnosed with ADHD, there is a 40% chance that one or both parents are ADHD. So, like, I had a conversation with a friend of mine, and her son was going a little bit nuts. And there's DVM moms with neurodivergent kids is a group, a Facebook group, and we support each other. And she was saying, oh my God, this comes from his father. And I'm like, girlfriend, you are brilliant, right? You fit all of the patterns. I think you need to look in the mirror, right? Obviously, it wasn't my place to say that. I'm friends with her, but not that good of friends with her. And I was like, wow. And now, as I get to meet people, I'm like, yes, 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 yes. But I say, yes, yes, yes. You're my family. I know how to communicate with you. I connect with you because we sit in the same boat.
And since this podcast is quite a bit, I mean, we talk about definitely life because that is a big part about who we are and it impacts everything that we do. When it comes to your career,
Mhm.
how do you think that now that you could put words behind it, can you, in hindsight, reflect back and see how
Oh,
some
yeah.
of these things came up all the way from vet school and on?
Yeah. So I always said I was an introvert. And now I realize it's because I don't like the small talk, right? If people are talking sports, stick a fork in my eye. Oh my God, that's painful. Yet if you're talking about dogs, right, or hanging out with dogs, absolutely, right? I'm right in there. It's what you're interested in. Things like, empathy is huge. So neurotypical people are more likely to be cognitively empathetic, meaning I know what you're feeling. Neurodiverse people are more likely to be an effective empath, which means I feel what you're feeling, right? So, oh my God, I am putting your dog to sleep and I feel the trauma, the heartbreak that you're going through. And I think a lot of people in the veterinary world will hear that and say, oh my God, I do, right? I cry when I do this because I'm feeling what that grief, that heartbreak that owner is feeling. There's so many things.
Well, on that note, that makes me wonder, is there some link between that ability to feel the empathy and a higher risk of
Oh yeah,
compassion fatigue?
absolutely. Absolutely. So things you need to know there, again, because because I'm autistic and I hyper focus and like study, right? And you say, okay, are you passionate about it or obsessed? And the answer is yes. Um, 4 signs, we think of fight or flight. But when you're trying to identify what you're feeling, there's flight, right? I'm running away. There's fight. I'm going to get in your face. But there's also freeze. Oh my God, I don't know what to do. Or fawn. Oh, I'm so sorry. Let me make this up to you. And if you feel any of those with a strong emotion, that is releasing cortisol into your body, which is just something that was designed to help us survive, right? But it's supposed to be short term, and then we come back down. And if it stays up, the only way to bring cortisol down is insulin, right? Which, when we release a lot of insulin, it changes our metabolism and we gain weight, right? Which is one of the things to think about. But two, we get adrenal fatigue, and we go toward anxiety, and then it goes from anxiety to a meltdown, right? So that's where I'm exploding outwardly. I'm short with you. I'm mad. I'm showing outward signs of my fear, my anger, right? Which is part of all of that. And then it goes into shutdown. I can do whatever I need to do because I am numb. And it's actually the dorsal vagal nerve that shuts off our emotions so that we can do what we need to do. Again, a survival thing. But we have gone from anxiety to meltdown to shutdown. And that's a dangerous place to be, because that is one step down that slippery slope of, do I really want to be here?
Well, that is terrifying. But again, I think this goes back to the better we can improve our self awareness, the better we can watch out for these things.
Mm-hmm.
And we know that, oh, okay, I'm feeling this very strong emotion. I'm reacting this way. I need to maybe go into another room for a
Mm-hmm.
second. So you can kind of find these triggers and hopefully start to tell yourself, okay, when I feel this, I need to do this. And so
Mm-hmm.
you kind of give yourself, is that something that you've tried to do
Yes.
for yourself?
Yeah.
Do you have an
My
example?
my release is hiking. Take my
Mm,
dog for a walk, don't talk to people, just go out in nature, which again has a lot of positive effects on the brain. And even walking is like EMDR, right? Where you're stimulating yourself and helping release negative emotions and stuff like that. And again, from studying, quiet, right? And if you see somebody who is going through that, one of the things I want to teach on is, you're at work and your coworker is blowing up for no reason. Don't go, oh my God, she's such a jerk, right? Or whatever. Go, oh my God, she's going through something. Don't talk fast to her. Don't lean into her. The calming things to do would be to lean back. Don't talk fast. Go slow with a low voice, right? And have a calming presence. And you should see them hopefully come down a little bit. Whereas if you're like, hey, you didn't do blah, 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 that's going to escalate everything. One of the other things I read, and I love the idea, is having a stuffed animal at the clinic.
mm.
We talk about the pink elephant. So if you see somebody having a hard day, you take the elephant is where everyone can see it, but it's up. And you take it and you put it in the middle of the room. And only he who puts it down, who has identified that somebody is having a bad day, is allowed to put it back up. But that keys everybody else on, hey, somebody's having a hard time. Let's be extra empathetic, compassionate, kind, helpful, so that I think of it, a clinic, as we're only as strong as our weakest link. Let's be strong together and help our weakest link be strong. And then when the person who identified it said, okay, situation is under control, they put the elephant back away.
And you mentioned that a lot of people who are neurodivergent also are attracted to animals.
Mm-hmm.
Having that clinic cat or
Mm-hmm.
something that can also maybe be back in the office that they can go
Yeah.
and pet the cat or something like that, I think is also kind of nice for us being in the veterinary profession, kind of pulling back in the connection to the healthy animals and not necessarily the stress situation around animals.
Yeah. And once you identify, and again, something that may help you identify is stemming. Are you familiar with that term?
No, I don't think so.
So it can be hand flapping, like, oh, God, I'm so excited, right? Or spinning, dancing, twirling, tapping their hands, doing their fingers, right? All of that kind of stuff. For me, I stroke my palm when I'm nervous. I massage my palms or outline my fingers. It sounds absolutely crazy, but it helps me come down. I, you're going to totally laugh. See if you can envision this. My favorite color is like a sapphire blue. And I bought a 1970s fuzzy cover to go over my steering wheel that where the plush is like that thick. And everyone's like, Laurie, what is that? But when I'm driving, I can rub my hand over it and it calms me down. Right. So stimming is whatever you do to stimulate your body or soothe your body. It's self-soothing to help you get back and be comfortable in your own skin.
I don't laugh at all. I think that's a really good insight because I mean, think about how often you drive, probably,
Mhm. Right.
and
House call
if
vet.
you have road rage, that's a good place to have something that you can soothe, and it's safe. You're not like
Yes.
hands are still on the wheel.
Right. Right.
I like that. Now, as you mentioned, you have really leaned in to learn a lot about this topic.
Mhm.
You are speaking on this topic at keynotes and conferences and all sorts of things. So, as you have, of course, learned it for your personal self, and now that you're studying it even further, what are some key things that you find are important to share with people about neurodiversity?
I would say the first thing is if you have any thought that you might be, or someone in your family or you work with that you care about is, learn more about it. Knowledge is power. Because if you know enough about it, then you can make educated decisions on behavior. So whether it be your child who's acting out, or one of the things that made me think about neurodiversity in the veterinary world is, now you're young, but when I was young and working at vet clinics, the surgeons would yell at people in surgery, right? So when they're stressed, throw things. Yet they were brilliant, and people would say, "Oh, they're excellent," but they have no bedside manner. And I'm like, "Oh my gosh!" Now I know surgeons who are amazing, who are kind and compassionate, but when we think about that old surgeon stereotype, right, that kind of goes with it. And oh, I know another important thing to think about is OCD, right? We all know people who are OCD. You think of like Sheldon, right? Penny, Penny, Penny. Um, when somebody has those behaviors, whether they know it or not, it's because they have anxiety rising up in their body. And if we are like, oh my God, stop the knocking, that increases their anxiety and isn't helpful. Whereas if we realize that, hey, they're doing this because they're anxious, and even if they don't know it, if we can get them to talk and think about, why are you anxious? What's going on in your head? How can I help you? That will diffuse the situation and help everybody work better, be better, live better. I guess it's big takeaway is be kind, compassionate, know what you're dealing with. And we all want grace when we're in a bad place, and try to give grace when you see somebody else in a bad place.
I think that's a very good take home. Another one, I wanted to come back to the camouflaging. I had
Mhm.
mentioned, we talked about that at the beginning. I recognize masking, like that I get, but when I was listening to this conversation and they were talking about camouflaging, they spoke to it in a way where people basically couldn't feel like they could be themselves. They had to put on this mask. They had to be able to do certain things to be appropriate in the social norm.
Mhm.
I understand the need. Like you have to work in society, and that's why we all need to learn more and be able to support each other. But it just brought up those ideas about wanting to feel like yourself. And they also told one story about a child, and she had mentioned the hard part about Christmas, and her mom was like, "What's hard on Christmas? Christmas is great." And she
Mhm.
said, "Remembering to put a smile on when you open the gifts." And her mom's like, "So you mean like smiling even though you don't like the gift?" And she said, "Any gift." Like it was just not natural for her to smile and express herself that way.
Mhm.
And so I'm just kind of curious more to that. Can you speak on how to work with society, help people understand, but also at the same time be comfortable in who you are?
One of the things I would say is from the research that I've done is to be comfortable in your own skin, hang out with people who are like you and understand you. Right now, when we go to work, we have to be around all people and we may or may not camouflage, right? So camouflaging is very strenuous mentally, right? So, like you said, the little girl who had to think about smiling, right? So, you have to think about when I go to work and see Mrs. Smith, she smells really bad, and I still have to put a smile on my face. And Mr. Miller's dog is going to try to bite me, but I still have to smile and, you know, if he's bitten me before or even care, I have to pretend to care about this dog who really I don't want to see, right? Camouflage is literally, if you think about putting on a suit, right? That's not you. And the best way to deal with it is when you don't have to find people like you, find things to do that you like to do and do them so that you have a chance. They've actually shown that people that live in the camouflage world, there's higher depression, there's more suicidal tendencies because you don't believe in yourself. Your self-worth goes down, you have more shame, you have more guilt. And when you surround yourself with people like you that you can be yourself with, right? Your tribe, then your self-esteem goes up, your self-worth goes up, your attitude goes up. You're just an overall happier person. So even if you have to, I don't even want to say have to, even if you choose to put on the camouflage for work, surround yourself by the people that you can be yourself with whenever possible.
I think that's a very good lesson for everybody too, because like you said, there's always going to be challenges in a work setting. There's always going to be some things that are a little bit harder for us. Like maybe you're an introvert, right?
Mm-hmm.
That it's hard to have those uh, the not deep, but shallow. That's shallow conversations to start things off, and then you get the home at the end of the day, and you're just exhausted to find the things that rejuvenate you, whether it is finding the people that you do feel comfortable to be yourself around. That's really important. And I think we forget about that sometimes because we either work so much or we forget that that's such an important part of taking care of ourselves.
Mm-hmm.
And it's like, yes, sleeping is good. Eating well is good, but
Mm-hmm.
it's also good to make sure that you're surrounding yourself with people that you feel comfortable with.
Mm-hmm. Absolutely.
Well, and I think this might flow into the next question. And it is me recalling the story that you shared of this might have been the first time that you spoke on it publicly, but I think it was that keynote that you mentioned. And you give this keynote presentation and you described that quite a few people came up to you afterwards. Some in tears or close to tears. They felt so strongly after hearing this, and I wanted to hear your words behind what do you think was it about this presentation that so emotionally connected these other people?
I want to start by saying when I felt the need to present this, I was being very vulnerable, right? Because here I am taking off my camouflage and saying to 350 people, this is who I am. And I was afraid because I had removed my mask. And I went up and I started to talk about it and explain my story and what I've learned. And I put up the slide of if you think you or somebody else that you care about has ADHD, here's a bunch of tests that you can do online in the privacy of your own home and find out the results. And 80%, if not more, took up their phones and took a picture. And I said, I'm home. I'm going to cry, right? These are my people. They get it and they understand it. And that made the rest of the talk really easy, or at least easier. Um, I think people were like me. Right now, our brains always think everybody's like us, and it's not true. But I think that that group was like me before I was diagnosed, of maybe I'm different and I have to hide behind my mask to appear same so that I'm accepted, because that's what we want in society. And I just gave them the permission to say, you can be different. You can be you and still be accepted and loved and understand yourself, and you are worthy.
That is an amazing message. And the fact that a large number of neurodivergent people are attracted to our profession, hopefully that is kind of encouraging that there may be someone who understands you not very far at all. And so, yeah, it is scary to be vulnerable, but it is individuals like you who are willing to take the first step to make us feel more comfortable, to know that we have someone that we can at least start going to and have conversations. So I really want to thank you so much for all that you're doing and continue to do, that we continue these conversations. I want to leave it open. What else would you like to make sure that we talk about specifically on this topic?
I would say the tests are great to get an idea, but if you think you may be neurodivergent, get professional help, right? I think all of us can use a therapist. I know my therapist I've been using for years, and I could say she could save my life. I, thank God, have never been suicidal yet. I've been in some dark places where she has helped me see myself and see my worth and see my prospects and be able to identify where we are, wherever we are, and make choices to help us get to be in a better place. Because no matter where we are, we can make choices to be in a better place. What else can I tell you? I think it is important. If you are autistic, there are organizations that you can join, but there's one to be weary of. Oh, you know what? There is something else we need to talk about. So there's the National Autistic Society in the UK, Autistic Self Advocacy Network in the US, Autistic Women and Non-Binary Network. There's one called Autism Speaks that has zero, from what I read, zero autistic people on their board, and they try to cure people of autism. And I would be very, very hesitant to go in that direction. And I'll just leave it there because everyone can make their own decision. I do, if it's okay, want to talk about some of the things that, if you are neurodiverse, can have comorbidities, if that's
Okay,
okay.
sure.
So if you have ADHD, comorbidities, depression, substance use disorders, generalized anxiety, social phobias, other phobias, panic disorder, bipolar, dysthymia, which is mild depression, OCD, obsessive compulsive disorder, intermittent explosive disorder, eating disorders, hypertension, type 2 diabetes, obesity, asthma, and migraines. And the reason you need to know that is because if you have ADHD, you are more likely to have an early onset, increased severity, prolonged duration, and increased complications, and more likely to relapse. And I think, as so many people in the US now, or wherever you're listening from, we deal with, type 2 diabetes, obesity. If you know that you're going to be prone to that, again, maybe you can make some different decisions, have different choices that can be helpful. The other things would be any neurodiverse person, their eyes are more sensitive to blue light. So having blue light glasses helps protect your retinas so that you don't lose your sight as quickly. Autistic people are hypersensitive to pain, and they have found, and that's from brain scans, they have found that when a autistic person is in a painful situation, their empathy score, how empathetic they are, drops dramatically, which I thought was very interesting. I think that's it. I mean, that's the health stuff is really important to me, right? Because If you are autistic, you're more likely to have GI problems, hypertension, and epilepsy, which I thought was interesting.
Interesting. The tips around blue light glasses and things like that, I think all of these things are so important. Again, back to self awareness.
Hmm.
Life is stressful, and I'll admit right now it's very stressful. There's a lot of unknowns going on right now in the world, and
Yeah.
so you have a threshold of tolerance for being able to handle things, and being able to have blue light glasses that help lower you down just a little bit. Sometimes that's what you need. I've had one conversation where we talked about how fear free was beneficial for the humans in the clinic, because when you don't have a kennel of barking dogs,
Hmm.
that's one level that can lower that threshold, just, or I guess help you come down from the threshold that much more. Having comfortable seating in the office, like those kinds of things that we can start to implement to help us help ourselves be the people that we want to be. And so I think those are extremely important tips around our health. I know lots of people who they'll say, I choose not to drink because I know
Yep.
alcoholism is in my genetics, it's in my
Yep.
family, and I don't want to take
Yep.
the risk,
Yep.
right? And I think we need to respect that. We just need to be aware, if someone says, I've made the decision to do this,
Hmm.
respect that and
Hmm.
support it. And so I think, again, it comes back to, I see vet med as such a collective. We're such a close community. There's not that many of us if you really think about it. And the more that we can support each other, the better.
Hmm.
And so learning more about it for ourselves, for each other, I think is just so, so crucial. So thank you for sharing those extra tips. And kind of to that, maybe a final question to land on is, if you could envision an ideal veterinary medicine where we are accepting of this wonderful neurodivergent group of individuals in our profession, what does that look like?
Like you were talking about with fear free, right? I would love to there to be a place where someone who's, I don't even want to say neurodivergent, because I was talking to people that worked at a restaurant, at a really high end restaurant, and they have a program, loosely termed, where when someone gets to their point of break, they have a magic word. They
Hmm.
come into the back, they say that word, and they leave the building. And everybody else knows that they're going to cover their tables, do whatever they need to do. That person has to stay out for 10 to 15 minutes. They're not allowed back in until that time is over. So they can't feel the pressure of, oh my God, I have to get back in. It's, I have to stay out here because that's the rule of the group. And it's not everybody ganging up on somebody because, oh my God, you did this twice last week. It's, you cover my back, I cover your back, and everything runs smoothly and it's a happy place, right? And I think that environment where people can work together, when they can identify when someone's having a bad day, when they're struggling with something, because we never know what's going on in each other's lives, right? What's happened today with their parents, your family, whatever. And just be really compassionate and mindful for yourself and for the people, and not just work, right? How many of us maybe have a bad day at work and we come home and you may say something you don't mean to your spouse or your child or your pet. So the best thing I could say, the best place vet medicine could go would be where when someone's having a bad day, there was a place that they could go, right? An, the lunchroom, outside with a table, because outside, just being outside with fresh air and bright light and green helps our brain come down. Maybe, with stones or a candle or whatever makes you in your happy place, have something for people like that, and talk about it. Maybe have one of your staff meetings talk about, hey, I saw this and so did this, and have it be really positive, right? I saw Janie help Mrs. Smith out to the car after blah, blah, blah. And I just want to call you out because I know you were struggling that day too. And, I, that's a really nice thing to do, and help each other feel good about ourselves, because in the end, we're all trying to do the best we can. right? So if we can help and be positive with each other, that helps all of us.
I agree. I think we need to avoid that self sacrificial perspective because I think that can be really common in our industry. It's like
Mhm.
who can suffer the most? Like, I took the most, cases this day, and I even took that evil Mr. Smith, who is always the worst client ever. I think we do need to like definitely get away from that, which I think we are. I think it's getting much better. So I hope to see that in the future as well. I hope I can support that. And the restaurant comment,
Mhm.
I have heard that before too. I think it was a very famous person. She worked in a diner, so it's not just high end. Maybe it's
Mhm.
at the restaurant industry thing, but they had that too. Is especially in like diners, you could get like back to back shifts. Sometimes they were just so busy, and they had like a special code word that when you were at your point, you said the word, and you automatically get to take a 5-10 minute break. I forget exactly how long, but
Mhm.
like, and people immediately knew we cover her or we cover
Mhm.
him. He needs to go. And I think that's a great system too to have. Pink elephant is a good idea. Code words, that is so important to constantly be thinking about that instead of just, how do we make revenue in our clinic? How do we keep doctors? Well, that's a great way to keep doctors is
Mhm.
making sure that they feel comfortable just being at work.
Well, and not just the doctors, right? The
Or
techs, the
yes.
assistants, the
Mhm.
receptionists. We need the whole team.
Exactly. Well, thank you, Laurie. I've really enjoyed this conversation. I keep learning about it, and I think we just need to, like you said, one of the best things we can do is just constantly keep learning. And luckily, we're a group of learners, so embrace it, and we'll make that beautiful vision that you see for veterinary medicine.
I sure hope so. I think we'll all benefit from it.
I hope you enjoyed this fascinating veterinary story. We can make an impact in so many places. Check out the show notes for lots of resources. Please make sure you are subscribed on your podcast app, subscribe on the YouTube channel, and follow me on LinkedIn where I hang out the most. You can contact me on LinkedIn, on the website at vetlifereimagined.com, and brand new is that you can text me. To send me a text message, find the link at the top of the show notes below that says, send us a text message. I want to thank our longtime sponsors, Fire Consulting and Will Hughes, who support the podcast over on our hosting platform, Buzzsprout. You can support the podcast too. Just check out the show notes for a link. And I hope to see you next time on Vet Life Reimagined.